Hello, this is a special edition on BGU Radio, presented by Professor Limor Aharonson-Daniel, Vice President for Global Engagement and Head of the Prepared Center for Emergency Response Research at Ben-Gurion University of the Negev, and Professor Nadav Davidovitch, the Head of the School of Public Health in the Faculty of Health Sciences at Ben-Gurion University of the Negev, and they will talk about the implications of the coronavirus on our community.
Hi, Limor.
Hi, Nadav. Nadav, as Vice President for Global Engagement at Ben-Gurion University of the Negev, I have responsibility for international students that may be abroad for the semester holiday and coming back, and for Israeli students that also traveled and came back. With all this discussion on the corona, what would you recommend to these students? What should they be aware of?
Okay, so first of all, we are in a very special period right now. But it's very important to understand that Israel is one of the most prepared states in the world, especially since the implementation of the international health regulation that Israel signed. I was working in the Ministry of Health when we started to implement it. The first thing to remember that we don't need to panic. Yes, we need to be aware. We need to think about preparedness. But finally, we have now, unlike the period of SARS, we have now a very solid international network of collaboration led by the World Health Organization. There is a collaboration with the Chinese government that are much more transparent now than they were during the SARS epidemic. Probably also they don't have now the option not to be transparent enough because of the internet and globalization processes. So in terms of a student, I think that it's very important to comply with the Ministry of Health recommendation. And we need to remember that finally, the disease now is mainly in China. We have thousands and thousands of cases. Unfortunately, also now more than 1,000 people dead. But in other countries, although there is a spread, we are talking about very, very small number. Even in Thailand, the next country, we are talking about a few dozen of cases. So I suggest that, first of all, just to apply all the regular hygiene. We need to remember that we are now in the winter. We have a flu season. By the way, more people are now dying in the world from influenza than from the new coronavirus. So please apply all the necessary hygiene, meaning that it's better to clean your hands every time and then. It's very important to sneeze in your sleeve. And of course, if there are students that returning from relevant countries, please abide to the quarantine requirement, meaning that you need to stay at home for 14 days. This is not so easy. But finally, I think that it's a matter of solidarity. The name of the game here is halting the spread of the disease. And when we are buying time, and right now in Israel, there is no case, probably there'll be one, but buying time, it means that you are halting the epidemic, that, the difference between one person meeting 50 people or meeting 2 people is very, very different. Now, we need to remember that this is a disease that started in China, but it's not a disease of Chinese. I'm saying that because, unfortunately, we saw many cases of racism here. I think that what is unique about Ben-Gurion University, that we have the School of Public Health, and we have within the school all of the necessary components, and many of us are involved, meaning that we have components related to laboratory and basic science. We have components that are related to the clinical aspects, epidemiological aspect, policy, economic, and we have also the preparedness center that you are heading. And I think that it would be great if you can tell us, Limor, how the prepared center might be also relevant to answering to some of the questions you asked.
Yes, it may be. The Prepared Center deals with different emergencies and the various aspects of preparedness for these emergencies, not necessarily medical ones. When we deal with a medical emergency or a potential threat as this one, we usually go to the clinicians and ask them what to do. The aspects that we focus on more in the center are on the community how does this affect the community, not health-wise, but in other senses. For example, the resilience of the community. It's very important that people don't panic. It's very important that people comply with the guidelines given. And in order for people to comply, they have to trust the information that they receive. So I think that building trust from the person providing the information is one of the most essential steps or stages in really being able to stand up and resist, if that's the right word, the contamination. If people comply with the guidelines, they get back to Israel, they stay home for 14 days, they don't go into the public domain for 14 days, the chances of increasing the spread go much, much lower. So I think the trust is probably one of the basic things. In general, if we look at community resilience, and the university is a community, then trust in leadership is one of the important components of resilience, and that's what I would think about when I spread the messages or send the messages. I think one of the important things about this podcast, in fact, is that talking about the things that may scare people or may fear, and listening to you and understanding that actually it's not as bad as it may seem just from listening to the media, and thinking about people who have flu and we don't panic about them. Understanding that if we keep these measures of really washing our hands very frequently, not sneezing without a handkerchief or into our elbow, not keeping a distance of 1 meter from the person we're talking to. If we watch all these steps, then immediately we're reducing the chances of being infected.
I think you raise a very crucial points that finally are part of public health thinking. The question of trust here is, of course, very important. Also, the question of solidarity. The idea that we are dealing with communities and not just with individuals. I want to raise another point here, and this is the idea of how to develop a multi-sectorial and interdisciplinary approach. And I think that here at Ben-Gurion University, within the School of Public Health, that's exactly what we are trying to do. Again, we need to remember that this is not going to be the last challenge in terms of such outbreaks. We are dealing with processes of globalization, processes of climate change, different interaction between animals and humans. So this approach that sometimes is called One Health or eco-health, that's something that we emphasize a lot in our teaching. And just the last day or so, the Minister of Health announced new measures, and we need still to see how things are going to develop. It's not clear if we are going to end this outbreak, or it's going to take some time. Vaccines are still far away. So in many ways, we are going back to very traditional and even old, I might say, but very efficient public health measures, such as hygiene, quarantine of people that were exposed, isolation of people that are already sick. It's not the same. And I'm very proud to say that many people from the Faculty of Health Sciences and the School of Public Health are involved with the government. So we are taking also our national role within this episode. I really want to strengthen our international students, especially those coming from China. They are part of our community. I can only tell about the global health course when we have every year students from China. We are in touch also with our alumni. Some of them are really in some stressful situation, and we are strengthening them. I saw the initiative that you were leading about saying that we are supporting them. I think this was very important indeed.
Thank you. I think a message to all our Chinese students and all our Chinese partners, actually, in various universities around China. We understand that this is a very difficult time because of the effect of this on their daily lives. But we really hope that with these brave measures that have been taken, we will soon overcome. And hopefully this summer, again, we will see hundreds of Chinese students coming to our summer courses, not only in global health to learn about this virus, but also for data mining, the Entrepreneurship Challenge, and many other courses and programs that we have.
I totally agree. Just to say that we have now the application for our summer course for global health is still open. So I'm sure that we are going to discuss the coronavirus case study. Hopefully then it will be over, but it's really hard to tell right now. Thank you, Limor.
Oh, thank you very much, Nadav. Thank you.